Doctor, what is the diagnosis? This essential question is one of the pivotal focuses of our healthcare system, because knowing the diagnosis is one step closer to treating the disorder. Unfortunately, phrases such as, "we don't know," and "we're not too sure," are heard too often. This experience is especially true for patients and families affected by frontal temporal dementia, a hereditary neurodegenerative disorder. Frontal temporal dementia, or FTD, is characterized by brain tissue loss within the frontal and temporal lobes and causes drastic changes in personality and behavior. For example, patients with FTD engage in inappropriate social behaviors. They lack empathy towards their loved ones, and they have difficulty recognizing other people's emotions. As the symptoms are quite variable and overlap with psychiatric disorders, detecting this disorder, especially during the early stages, is quite challenging. Accurate and early diagnosis is so critical because there are treatments in clinical trials aimed at slowing down the progression of this disease. These treatments, however, need to be administered during the early stages of the disorder, before substantial brain tissue loss occurs. The problem is, we're not really good at diagnosing these individuals, especially during the early stages of the disease. This is where my research comes in. I use neuroimaging techniques in order to identify early brain changes in individuals who are at risk for developing FTD. Specifically, I target the core symptoms of FTD, and I look at the amount of brain tissue loss and the amount of brain activity during emotional processing tasks. What's really exciting about this work is that we can actually detect subtle brain changes in these at-risk individuals years before we expect to see their symptoms. This means we can use these brain changes in order to help diagnose individuals earlier along in the disorder. So perhaps in a few years from now, when a patient's family asks, "Doctor, what is the diagnosis?" we will have an answer. Thank you.